Check out this episode of Cutting Edge Health, Preventing Cognitive Decline.
We've heard about this now for almost 20 years, and that's resveratrol, which comes from grapes.
Resveratrol is in the skin of the red grape, which is why there have been some studies showing that red wine can be good for the heart. Unfortunately, those studies have shown that red wine, 1 cup a day, can benefit a male as far as cardiovascular disease, but the studies have not shown that to be true for women, as even 1 drink a day does increase a woman's risk of breast cancer. Because yes, there's resveratrol in the skin of the grape, but there's also a lot of sugar from fermenting the alcohol.
So you can't get your resveratrol from just drinking wine.
I don't generally recommend it. I do think that resveratrol is an important supplement, especially right now in the age of this COVID pandemic. But what resveratrol does is it's a really potent anti-inflammatory for the body, but very specifically for the heart and for the blood vessels around the heart. So I use it to treat people with a high cardiac CRP marker. It's a high sensitivity CRP that shows that there's inflammation around the heart arteries. Resveratrol is very good at calming that down. It also decreases cellular aging, according to Dr. Sinclair, especially when you're taking resveratrol along with doing the intermittent fasting. That seems to really boost its ability to decrease your aging at a cellular level. I do recommend not taking more than about 200 milligrams of resveratrol daily, and I recommend combining it with the next supplement, which is called quercetin. If you can find it, the trans resveratrol does seem to absorb a little bit better than the plain resveratrol.
Okay, and he goes up pretty high. He goes up to 1 gram, doesn't he, of resveratrol? But you kind of think that's a little hefty?
I think you have to be careful because there has been some studies that showed that if you take too much of a lot of these anti-inflammatory herbs, resveratrol being one of them, there's been some limited studies showing that when you get up to that 1,000 milligrams, you can actually increase inflammation in some people. So I tend to think that trying to balance that, so a little bit of resveratrol with a little bit of quercetin, combine that with the diet and the intermittent fasting, and now we're talking about getting this ball rolling of how to actually improve cellular function.